You were asked to stop self-medicating and you think the person is talking rubbish, right? I will not blame you. But when I will blame you is after watching this video and you are still practicing the same thing. That is when I'm going to blame you. Now, pay attention to this video, bring your chair closer and listen very attentively. When you're talking about self-medication, we're talking about people that uses their hands to treat themselves without going to the hospital to see a doctor or a physician. Self-medication has a lot of negative effects to man. That's why we are creating this awareness to people, letting them know that what they are practicing or what they are doing is actually wrong. Now, do you know that self-medication can lead to what we call wrong treatment? Yes, in the sense that you don't know what you are treating. You are just treating yourself for no reason. Maybe because you are having a sign or symptoms, you begin to treat yourself. You are giving yourself a wrong treatment. Apart from that, self-medication can equally lead to what we call dangerous drug interaction. What it means is that there are some drugs that are not supposed to combine together. Yes, but you don't know about it because you're not a health personnel. You don't even know what you are doing. There are drugs you're supposed to combine and there are drugs you're not supposed to combine. Like if you watch when doctor gives you a medication, he will give you an instruction. Take this in the morning. Few hours later, like maybe 6 hours or so hours, you should take this. Because he has seen that these two drugs cannot interact. Or he will tell you, take this in the morning and take this at night. Because he understands the interaction of these drugs, that the two cannot go together. When the two are being combined, it's going to cause a problem. That is what we're talking about on drug interaction. Another one is side effects. When I talk about side effects, all drugs have their own side effects. There are some that are very dangerous. There are some that are mild. It is only the physician or healthcare personnel that understand these side effects of drugs. Before a doctor can give you a medication, he will ask you some questions. He will do what we call physical assessment. He might ask you questions like, how do you do this? How many times do you urinate in a day? What is the color of your urine? Do you have pain? The doctor will first examine your body, know your health status, if your body can be able to at least accept or adapt this side effect. Is it going to cause you any harm? Is it going to cause any problem to your health? Is it favorable to your system or not? If it's not, because after each drug have their own side effects, the doctor will check the drug if the side effect is favorable to your own body type. If it's not, it's going to change the medication for you. Another one is delayed diagnosis. Delayed diagnosis is in a sense that someone is having sickness. Yes, you're having signs and symptoms of a particular illness. Because you have assumed that this is the cause of it, you sit at home, you use your hand and order for medications. Give me so medicine, give me so medicine, you begin to take them. On the process of doing so, you are endangering your organs, you are destroying yourself. That is the reason why people, if you watch in Africa now, there is an increased rate of people suffering from kidney disease. Because of what? Most of these people we are seeing today suffering from kidney disease might have been seeing some signs and symptoms in their body, but they neglected it. They assume that it's malaria because everything, I understand everything in Africa now is malaria and typhoid, and it's not. Do you know that infection also have similar signs and symptoms like malaria and typhoid? There are sometimes someone will have infection, untreated infection. You'll be having those signs and symptoms. Your body is passing information to you that you should go and treat it. The person will begin to take over-the-counter drugs, whereby endangering his or herself. So what you need to do is avoid taking medications on your own. This is very important. Self-medication is very, very dangerous if you understand the implications of what people are doing. The last but not the least is what we call antibiotic resistance. If you watch now, a lot of people after being tested for maybe one particular infection or the other, you will notice that they are having too much of resistance of antibiotics because of what? Misuse of those antibiotics. People like taking antibiotics on their own. Antibiotic is a prescription drug. It should not be given to people anyhow. In Africa, they sell antibiotics to people, which is not supposed. Before a pharmacist sell an antibiotic to you, you must show the person a written note from the doctor. You can't just come to a pharmacy store and request for an antibiotic and they'll give it to you. But in Africa, they do that. An antibiotic resistance occur when your body is used to those antibiotics, is now familiar to it. It's no longer a new thing. That's why it is important when you're sick, please do not use your hand and prescribe drug for yourself. Because when a sickness for that particular medication arises, what are you now going to use? Because your body is now used to all those antibiotics. It has mastered all those antibiotics. So when the time for that antibiotic to work in your body, when it's time for it to be used for you, it will no longer be effective. Your body can no longer see it as a medication because your body is already used to it. So my dear audience, the advice I'm giving to each and every one of you is to stop self-medicating. This is very important. If you want to live long, if you want to live a healthy life, avoid self-medication. I know things are cost, but it's better to do the right thing than to do the wrong thing. Okay? And I want to also use this opportunity to advise, especially those using herbal medicine. I'm not saying that herbal medicine is wrong, but let's do something in the right process than doing it wrongly. It's better you hear from your physician to get the right instruction or information required before you do anything. Thank you so much for watching. See you guys in my next video. Bye.